Hi, my name is Dr. Mike Evangel. I'm a chiropractic physician from Paramus, New Jersey. What I specialize in really is the human body and making people healthier. Now, that might not sound what a chiropractor does, but really as physicians, our job is to really try to look at the patient and maximize the deficiencies and minimize their excesses and put them into balance. Whether that balance is a biochemical balance, or a physiological balance, a physical balance. What we do is we look at all the different factors that go into a patient's life and figure out really what needs to be tweaked. Now, when we talk about stroke, we're talking about really things that need to be tweaked also. Stroke prevention. Now, stroke is a major cause of disability in the United States and cause of death. And what we really want to do is look at the basic pillars of health. It's not only for people to avoid stroke, but also to just be generally healthy. There's three basic pillars that I talk to my patients about as far as the human body goes beyond what you eat and all the other average things you might be hearing about every day. Now, the things I'm talking about might not be things that you hear about, but they're all vital. And if any one of these three things are missing, you're not going to be as healthy as you possibly could be. The number one I'll talk about is vitamin D. Now, I was interviewed a few times on vitamin D and the immune system and COVID recently. But besides all that, vitamin D impacts over 20% of the human genetic makeup. Vitamin D is so important for injury repair, for the immune system, to fight cancer, help prevent stroke, and be generally healthy. I like to see my patients with vitamin D level much higher than the 30 nanograms per milliliter that's recommended by the labs like LabCorp and Quest. What I like to see is around 80. Now, some people think, well, that's pretty high. Well, there was a study that was done a number of years ago at the NFL Combine in Indianapolis for the college players to try out for the NFL. And they found that the athletes that had the highest levels of vitamin D had the least number of injuries that were out on the injured list during their college days. So vitamin D is extremely important. Let's go to the next pillar. The next pillar is your gut health, your microbiome, the health of your gut bacteria. Now, we have about 100 trillion microorganisms in us and on us. A lot of that is in our gut. We should have about 2,500 different species of microbes, 2 to 3 pounds in us and on us. If we don't have a good balance of at least 85% beneficial to 15% pathological, we're not going to be healthy. And we're going to increase our chance of all disease, including stroke. The third is really something that I've been getting much more into as of late, and that is the omega-3 fats. Now, that's your fish oil and krill oil, salmon, sardines, all things like that. Now, for the vegetarians out there, I have some bad news for the vegans and vegetarians. And that is, even though you might be eating your walnuts and your flax, you're not going to get the same quality omega-3 fats in your body as you would from animal-based. Now, there's a lot of research going on with this. They're actually trying to make plants produce the omega-3s because there's really not enough fish in the ocean to get all the omega-3s to everybody that we should be getting. Now, since I graduated from chiropractic school, which was 1985, a lot of this research has occurred, and they found, in Harvard, this research was done, they found that you need, and there's a test that they do, the omega-3 index, and the amount of omega-3 fats in the red blood cell membrane should be at least 8 to 12% to be healthy. Now, if it's below 8%, your body can't heal. You can't repair not only your musculoskeletal system, but your blood vessels, which is extremely important for stroke. And what will happen is that if it's below 8, and most Americans around maybe 5%, they're not going to really be in that good shape. Plus, the blood is going to be thicker. The higher omega-3 is, the thinner the blood, and the thinner the blood, unless it's too thin, of course, there's an INR test that tests the viscosity, the thickness of the blood. It should be around 1 to be average. But what happens is that with higher numbers, it gets thinner. With lower numbers, it gets thicker. So we'd like to see, people that are maybe prone to stroke with a little bit higher than 1, maybe closer to 2. But the omega-3 fats help thin the blood, repair the blood vessels, and also help fight cancer, increase your immunity, which is also very important for COVID. It's good for injury repair and just about everything else. So those 3 things: vitamin D, the gut health, and also your omega-3 fats. Besides eating well and exercising and stress. Let's talk for a minute about stress, because this is something that's extremely interesting. I was just watching a video the other day about stress and about positive attitude and about healing the body. And it's been found that, there's what one doctor, he's also a chiropractor from New Jersey, another chiropractor from New Jersey, Joe Dispenza, if you look at any of his videos, he studied, which is really smart to do, I'm not just saying that because he's a chiropractor, but he studied spontaneous remissions. Now, spontaneous remissions are when people get better and they're not supposed to get better. It's spontaneous. But there's no such thing, in my opinion, as a spontaneous remission, because there's always a reason why the person healed. And he was looking at the continuities between these people. And he found that they had a strong faith, that they, a number of different things, but meditation, being able to handle stress, extremely important. And one of his seminars, there was a woman there, which is quite remarkable, that was suffering from Parkinson's disease. Went to almost every specialist on the planet. And just by having a positive attitude and thinking, good thoughts and not being negative, she actually got a lot of progress over the weekend seminar, because she was drooling out of the side of her mouth, could not really swallow, couldn't chew her food and eat, and she's making unbelievable progress. So the people that want to prevent a stroke and the people who have had strokes, stroke survivors, not stroke victims. That's the first thing. We don't want to label somebody as a victim. They're a survivor. Positive. As a matter of fact, I'm a big baseball fan. I like the Yankees. They're playing right now, as a matter of fact, the Yankees. They're up 2-0 when I checked last on the way over. But what happens is that you have baseball players have a positive attitude. They have to think positively. Negative thoughts are bad for sports, for life, for relationships, for everything. So, want to think positively and not negatively. So stroke survivors. Oh, with baseball I was going to say about the disabled list. It's now the injured list, because they were never disabled. They were injured. It was a misnomer. They should never called it a disabled list, because there's no disability there. So, think positively. Do not think negatively. Now, that's easier said than done, I know. But something's half full. It's partly sunny, not partly cloudy. And don't hang around negative people, too, that bring you down. Because they will just, they'll suck the life right out of you. You have to be positive and hang around positive people. And I think I've spoken enough right now about that, and on to the next topic, which is going to be, this is a great foundation. Now, I met the founder of the foundation, Renee, a number of years ago. I think it was probably close to 10 years ago at this point. And she came to my office because she became a patient. And then I was fascinated by her story, how she had a stroke at a very young age. And there was another friend of ours, that's Dr. Ted Corin, and he always says that nothing happens by accident. Everything has a purpose. Everything has a reason. God works in strange ways. So, Renee had a stroke in her 20s. She actually had a near-death experience where she went to heaven and she was told to come back, and she had to do certain things, accomplish certain things. It's not her time to be there, although she maybe want to hang out just for a little while longer. So she came back and wrote a book and started the foundation and helped a lot of people. So sometimes things happen and we don't really understand why. Horrible things happen. But we have to have faith and realize that there's a grand scheme, a grand plan with things, and see how things play out in the long run. because we never know what's going to happen at the end of the book. Okay, my name is Dr. Mike Evangel. Again, I'm a chiropractor from Paramus, New Jersey. And if anybody ever has any questions, you can always contact me through Renee, through the foundation. I'm sure she's going to probably put my website down on the bottom. If I can see it down there now, is www.drevangel.com. We also have, another company I have, we have tourmaline-infused products that really help increase what's called mitochondrial dysfunction. And all chronic diseases have two hallmarks, and people who get strokes also, two hallmarks: mitochondrial dysfunction and inflammation. Two very not so good things. And with tourmaline, what it helps do is it helps to, in my opinion, reverse mitochondrial dysfunction. Now, the major diseases that are involved with that, you have Alzheimer's dementia, autoimmune diseases, cardiovascular disease, stroke, heart attack, you have cancers, you have learning disabilities. They're all related to those two things. Now, primitive humans didn't have those two things like we have today. So they call it SAD, the standard American diet, because it is sad. So we have to start to try to eat better, eat wholesome whole foods. As Jack LaLanne said, if man made it, don't eat it. Again, Dr. Mike Evangel, thank you. And do not forget to donate to a very worthy cause. Actually, when you donate and you do good for other people, it brings up your endorphin levels. So you can be a little greedy and give because you're going to get something out of it. It makes you feel good. And it increases your level of health. It reduces your stress when you help others. So find it in your heart to go and make a donation, and you'll help people with strokes, with aphasia, to educate the public, and to do a good deed. And you'll feel better about yourself. So nothing wrong with that. Have a good day, and good night, or good day, depending upon when you see this. Okay.
That's great.
I had a very itchy nose almost the entire time. I can't scratch the once. They say that if you have an itchy nose, you can either get into a fight or kiss a fool. That's what my patients told me.